the advancement in technology, there comes the need to keep updated on the most recent technologies that will ease the work of clinicians, that is veterinarians dealing with small animals such as cats and dogs, so that they are able to make better diagnoses and, of course, which affects the outcome of the cases that they deal with.
I am Professor Sarafim Papadimitriou from Aristotle University of Thessaloniki, Greece, and my specialty is veterinary dentistry. I am a vet, I am a dentist, I finished human dentistry also, and I'm working as a veterinary dentist for about 27 years now. My job is in the university, and I'm training there students and, of course, dealing with cases of dentistry and oromaxillofacial surgery. We have many cases of periodontitis, of tooth fractures, but we have many cases of neoplasms, especially the last years, many cases, mandible or maxilla fractures, and some inflammatory cases of conditions of the oral cavity in cats, in dogs. Mostly these are the most common cases.
I'm Anita Patel. I graduated from the University of Nairobi in 1981, and I went to the UK to study for the Royal College exams, which I got in 1982. Since then, I have been in private practice mostly. From practice, I got a certificate in veterinary dermatology, and then went on to do the diploma, the Royal College diploma, and got a specialization in veterinary dermatology. There's a limitation onto the amount of drugs that are available, the amount of treatment, amount of resources for diagnostics. So there's a big potential to improve the diagnostics and the availability of various products to improve medication. And in the UK, I guess we have pet insurance, which allows us to do a lot more with our pets, because treating animals can be quite expensive, especially some of the testing and some of the surgery and some of the work that we have to do. So in the UK, we have pet insurance for veterinary treatment, and that is really quite useful. It allows practitioners to provide a lot more treatment in terms of drugs, in terms of the options that the owners can have, and it improves overall quality for the quality of care for the patients, whereas I think you lack that. It's not available here, and so there may be limitations into what people can afford and what people can do here.
My name is Dr. Dhaval Shah. I'm the veterinary pathologist at Pathologist Lancet Kenya, which is part of Sub Lancet Africa, and I'm also the chief veterinary officer. Pathology is basically laboratory diagnosis of any sickness or illness, or even just basically wellness checks. At Lancet, what we offer for veterinary clinics in Nairobi and in Kenya, basic hematology, routine serum chemistry, specialized serum chemistry, histopathology, cytology, and microbiology. And that gives the clinician or the veterinarian a deeper insight into what the animal is suffering from. It can be anything from an inflammation due to an infection. It could be a tumor. It can be an infection of the urinary bladder or kidneys or any of that. So what I presented during this Congress was basically the basics of how to have an in-house laboratory and how to submit samples for confirmation to a referral laboratory. So Lancet does have a dedicated veterinary section where clinicians do submit samples to us, but they also use other labs, and we are okay with that. Basically, the basics of how to have your in-house laboratory, just having a simple microscope, doing your smear reviews, how to take care of your microscope, and what is entailed in submitting a sample in terms of labeling the sample, filling out the request form, and submitting the samples that are required for the test that you want. You don't want a blood sample which may not be useful for serum chemistry, or you don't want serum which will not be useful for a blood count. So it's just basically going back to the basics.
I am Dr. Derek Chibeo. I'm the chairman of the Kenya Small and Companion Animal Veterinary Association. This is an association, a branch association of the Kenya Veterinary Association, and it brings together veterinary clinicians who are involved mainly in companion animal practice. Well, the KISCAV Congress actually is in its second session. We had our first Congress during the COVID time, but that one was a virtual one, and now this is our second Congress. KISCAV basically is 8 years old now, having been inaugurated and started in 2014. And one of KISCAV's core mandates and objectives is actually provision of continuing education, improving practice standards, and clinicians' knowledge and sharing knowledge amongst clinicians, both locally and internationally. We take it very seriously, and that's why, apart from the Congress, we've also been a leading provider of continuing education, even on the virtual platforms. So this Congress aims at trying to bring back that social aspect of physical congresses that we used to do as CPD sessions, and coming 1 year after really the dissipation of COVID, we thought that let's have a good physical meet, and this Congress that we're holding this year brings a very good program where we've got very good world-class speakers. We've got speakers from the UK, we've got speakers from France, and speakers from Aristotle University of Thessaloniki in Greece. So it's an international array of speakers, as well as an international array of participants, because apart from having Kenyans from across the country that are involved in companion animal, we've actually got a regional representation with participants from Tanzania, Zanzibar, Burundi, and the Greater East Africa region. We do have a very exciting program or plans for next year in terms of continuing education and